Okay, let's dive in. When you think about orthodontics, maybe you picture the modern stuff, right?
Uh-huh.
High-tech wires, clear aligners.
Yeah, the very contemporary image.
But here's something wild. The basic idea, wanting straight teeth, it's incredibly old, like
Hmm.
truly ancient.
Really? How far back are we talking?
Archaeologists have actually found mummies, believe it or not, with crude metal bits, sort of like wires, wrapped around their teeth.
Wow. Mummies with braces. So people were trying to move teeth thousands of years ago.
It seems like it. Which tells us, while that desire is ancient, the actual science, the predictable, structured approach we see now, that's much more modern.
Right. It has a specific history, a real evolution that completely shapes how orthodontists work today. The tools they use, everything.
Exactly. And that history, that journey, that's what we're unpacking in this deep dive. You've got your source material here, articles, notes, tracing orthodontics, from those very early attempts to the super sophisticated bracket systems used right now.
And our goal here is really to help you get a quick handle on that evolution, to understand why things like bracket prescriptions are so critical, and, how today's brackets aren't just simple wire holders anymore.
Think of this as your sort of essential backgrounder. So you can talk confidently with orthodontists about the mechanics behind what they do every day.
Makes sense.
Right.
Where do we start? The real beginning of the modern era.
Yeah, let's jump to when things started getting really structured. We're talking maybe 150 years ago, give or take. A big shift from those ancient trial and error things.
Okay.
And when you talk about that foundation, there's one name you just can't avoid.
Ah, you must mean Dr. Edward H. Engel, late 1800s.
That's the one, often called the father of modern orthodontics.
And rightly so. His biggest contribution, arguably, wasn't one single gadget, but bringing a system, some order, to how we describe bites. Classification.
And that system is incredibly still the bedrock today, isn't it? Over a century later.
Absolutely. He sorted all the different types of bites, or malocclusions, into three main categories: Class 1, Class 2, and Class 3.
Still hear those terms constantly.
You do. They're fundamental. They describe how the upper and lower jaws line up, specifically looking at the first molars. Should we quickly define those?
Yeah, definitely. Because it dictates so much.
Okay. So, Class 1. This is technically the ideal relationship at the back. Upper first molar sits just slightly behind the lower one. But, and this is key, even with a Class I bite, the front teeth can still be crowded, crooked, spaced out.
So the back is okay, but the front might need work.
Precisely. Then, Class 2, this is what most people probably think of as an overbite. The upper jaw is too far forward, or maybe the lower jaw is too far back. Result: the upper front teeth stick out, sometimes quite a bit, over the lower ones.
Got it. Overbite.
And Class 3, basically the opposite, often called an underbite. Here, the lower jaw juts forward, so the lower front teeth end up in front of the upper front teeth.
Okay, clear enough. Class 1, 2, 3. So why is knowing this classification the absolute starting point for the orthodontist? And crucial for our listeners, what does it mean for, the products they might discuss?
Right. This is where diagnosis directly links to the need for specific tools. Engel's classifications are used every single day. It's the framework for checking out a patient, planning treatment. It tells the ortho what kind of tooth movements are needed.
Ah, so the how.
Exactly. Take a Class 2 case, the overbite. The mechanics needed might involve moving upper teeth back or lower teeth forward or some combo. That immediately points towards needing certain kinds of brackets, maybe specific wires. Elastics are very common.
Or those Class 2 corrector appliances you sometimes hear about.
Perfect example. So if you're talking to a doctor and you learn they treat a lot of Class 2, you instantly know their focus is correcting overbites.
And that shapes your conversation.
Yeah.
You can talk about solutions relevant to that challenge. Maybe brackets that work well with elastics or those correctors.
Precisely. It grounds the discussion in their actual clinical work, their patients. It's a direct line from diagnosis to the tools they need. It shows you understand their world.
Okay, super important connection. Now, let's shift gears a bit. How do they actually attach these things, these brackets, way back when? Before modern glues.
Oh, it was a totally different ballgame. Back in Engel's time and for decades after, it was incredibly hands-on and, well, pretty invasive compared to now.
How so?
They had to fit and then cement a metal band, like a ring, completely around every single tooth they planned to move.
Wait, every tooth? Seriously, like a little metal belt for each one.
Exactly that. Molars, front teeth, everything. Imagine the work involved. And the bracket itself, which was simpler then, was usually welded or soldered onto that band.
Wow, that sounds bulky. uncomfortable.
Weary and hard to clean around, lots of chair time just to get the bands on. Definitely not ideal.
Yeah, I can imagine patients weren't thrilled. So what changed? What was the breakthrough?
The absolute game changer was adhesive technology. When reliable dental composites and bonding agents came along, maybe mid to late 20th century, that changed everything.
How did glue change the bracket game?
Well, it meant you didn't need the band anymore. Orthodontists could suddenly prepare the tooth surface, usually a light acid etch to make it microscopically rough, and then use a strong adhesive to stick a small bracket directly onto the front surface of the tooth.
Stick it on.
Essentially, yes. Bond it directly.
The impact must have been massive.
Revolutionary is not too strong a word. Starting treatment became way faster, much smoother. Patient comfort. Huge difference. Aesthetics. Night and day, no more full metal grin.
Less invasive, too, I guess.
Generally, yes. And critically, this bonding breakthrough freed up bracket design. Designers weren't limited by having to attach something to a band. They could focus just on the bracket itself, its shape, its function. This really paved the way for the modern bracket.
Which brings us nicely to today. So if early brackets were just handles on bands, then simple handles glued on. What are modern brackets actually doing? It's more than just holding the wire, right?
Oh, absolutely. Today's brackets are incredibly precise, sophisticated little machines. They're not passive holders at all. They're engineered to contain specific information.
Information built into the bracket, like little instructions.
Exactly like instructions. The way the base is shaped, where it meets the tooth, and crucially, the angles built into the slot where the arch wire sits. It's all meticulously designed. The source material points out 3 key pieces of info. First, torque. This controls the root's tilt, forward or backward, relative to the crown. Think tipping the tooth's axis. Vital for root position, stability.
Okay, torque. Got it.
Second, angulation, sometimes called tip. This is the vertical tilt, side to side along the arch, gets the teeth parallel, lined up correctly.
Angulation or tip, right?
And third, rotation, maybe the easiest to picture. This controls how the tooth is turned, twisted left or right on its long axis, essential for looks and how teeth contact.
So torque, angulation, rotation, all built into the bracket slot and base for each specific tooth.
For each specific tooth, the orthodontist isn't just grabbing any bracket. They're choosing one designed for, say, an upper right canine with the exact torque, angulation, and rotation values needed for that tooth built right in.
And that's where prescriptions come in, like Roth, MBT.
Precisely. Those names, Roth, MBT, and others, represent different orthodontic philosophies, different ideas about the ideal final tooth position. And those philosophies are translated into a specific set of torque, angulation, and rotation values for every single bracket in the system.
Ah, okay. So prescription isn't just one bracket type, it's the whole set, like a recipe.
Exactly. It's a complete system, a recipe for tooth movement. A Roth prescription means a full set of brackets, upper incisor, lower molar, etc., where each one is manufactured with the specific angles Dr. Roth determined were best to achieve his desired outcome.
And the source mentioned that different bracket lines, like precision or premium, they come in these different prescriptions.
That's right. The series name might refer to how it's made, the material, maybe it's self-ligating, but the core clinical choice is often which prescription is built into that series. The doctor picks the prescription that matches their treatment philosophy.
Okay, wow. That totally reframes what a bracket is. It's not just metal or ceramic, it's a tiny, pre-programmed tool.
A microengineered tool, absolutely. It embodies a whole approach to treatment. So when you talk brackets with an ortho, you're talking about these built-in 3D instructions.
And understanding that lets you ask much better questions, right? Show you get it. The source suggested asking things like, which prescription do you typically use?
Yes, that immediately taps into their treatment philosophy.
And another one. Do you prefer one-piece MIM or two-piece brackets? Let's unpack that one, because the source was careful about how it presented this.
Yes, it's important to be clear here. This touches on manufacturing differences and doctor preferences, often linked to perceived performance.
Right. The source didn't say one was definitively better, just different reasons for choosing one.
Correct. So the source mentions MIM metal injection molding. This process is known for creating parts with really high precision, very accurate dimensions.
Including those critical slot angles, torque, angulation, rotation.
Exactly. So if a doctor really prioritizes that precision in the bracket's built-in prescription, MIM technology delivers that according to the source.
Makes sense. Precision focus leads to MIM, maybe.
That seems to be the connection made. However, the source also notes that some orthodontists still prefer brackets made differently, often using a two-piece construction, and these often have a more traditional mesh pad or base that's attached to the bracket body.
Okay, and why the preference for the two-piece or mesh base, according to the source?
The reason cited in the source is that some doctors believe, based on their experience perhaps, that this mesh base provides a stronger, more reliable initial bond to the tooth.
Ah, so it's a bonding strengths perception.
That's what the source indicates is the rationale for that preference. So you have this distinction. M highlighted for its precision in manufacturing the angles, and the mesh base often preferred by some for what they see as more reliable bonding. It's about understanding those different priorities, precision versus perceived bond reliability as presented in the source, not about us saying which is superior.
Got it. So you, as the rep, don't push one over the other, but understand why a doctor might choose based on what they value most, the precision of the angles or the feel of the bond.
Exactly. It helps you align with their clinical priorities.
Okay, let's quickly recap the journey then. We went from ancient attempt,
So a structured, classified field, thanks to people like Dr. Angle, big step,
then the huge tech leap from banding every single tooth,
to just bonding brackets directly, much cleaner, faster, more aesthetic,
and finally, moving from brackets as simple handles.
to these incredibly sophisticated tiny tools packed with 3D information torque, angulation, rotation based on specific prescriptions.
The whole story is a move towards more customized, pre-programmed appliances.
And knowing that story, that evolution, is really key for you. It lifts your conversations beyond just product features. You become a partner who gets the history, understands diagnosis and classifications, appreciates the significance of their chosen prescription, and knows the nuances of the tools they rely on.
It's about speaking their language, understanding the why.
Exactly.
All right, so here's a final thought to chew on after this deep dive. Think about this evolution from basic attachments to these pre-programmed brackets. How does this ongoing refinement change the balance between the orthodontist's skill and the information built into the appliance itself? As the tools get smarter, how does the art and science blend evolve? What might that mean for the future of creating these amazing smiles? Something to consider.